It's hard for people to imagine what it was like in the 1990s and the early 2000s in Africa. The HIV epidemic was just totally devastating many of the countries in the region.
HIV was seen as a death sentence. If you were infected, there was no hope.
We were witnessing a global injustice.
At that time, it was difficult to talk about HIV. Every country was afraid.
The health systems and the communities were not prepared to manage this epidemic.
There wasn't the space even to offer care within public hospitals.
ICAP was one of the first partners that supported us scale up comprehensive package of HIV care.
WAFA said, we can do this. We can provide HIV care and treatment at scale when many people were saying, no, it can't be done.
For the millions of people living with HIV, the possibility of being able to take a medicine that could prolong one's life and actually enable people to live long and healthy lives was almost magical.
From the beginning, ICAP was one of our Track 1 partners who went out there when no one was on treatment and got hundreds of thousands of people on treatment.
It was important to have a group of individuals who understood clinical medicine and understood public health, bringing it all together to be part of PEPFAR and really have an impact in a very significant way on making antiretroviral treatment available in settings that really didn't have access to that kind of treatment before.
It was very much about harnessing the local resources, bringing together people to work collaboratively.
Our next task was to facilitate the availability of these life-saving interventions throughout the world.
The way ICAP is approaching technical assistance to the Ministry of Health is quite unique, because we do it together rather than doing it for them.
Because they really trust us and they really value the level and the quality of expertise that we provide.
The desire is to build bridges, the desire is to add value so that we are working in one accord.
ICAP is putting so much emphasis on getting testing down to the households, down to the workplaces, out on the streets.
In 2006, there may have been just several thousand people in the whole country on antiretroviral therapy. Now we have over 1 million.
Over the past 15 years, ICAP has evolved tremendously, focusing now on a multitude of other health issues, not just HIV treatment, but HIV prevention, maternal and child health, tuberculosis, malaria, non-communicable diseases,
electronic medical records, quality improvement,
educational models, training, mentoring, and capacity building.
Strong research and evidence-based intervention.
With the FIA data, we have a general idea of who's virally suppressed, who knows their status, who's on treatment. We were really excited about ICAP's role in this with CDC. If the country wants to do malaria surveillance in the future, if they want to look at diabetes, hypertension, we're building capacity that is relevant to any disease in any community survey.
We're pushing forward and we go where others may not want to go.
ICAP's model has saved and continues to save millions of lives, but its model also brings to communities and regions and countries a partnership for educating and bringing up the next generation of the world's leaders in global health.
I think it's fundamentally changed the way we think of what schools of public health, what governments, what countries can do in terms of world health.
We managed to save multiple lives that otherwise would be ignored, neglected, and lost.
I sincerely believe that if we can capture the energy and build on the success of today, that we can truly make a difference and truly overcome the disparities in health that exist around the world.